section that was very wasn't she had some technique and had to go to the first thing it has to be. Yes, ma'am.
All right. So if you've read and understood, considering it critical care scenario, please discuss all the possible nutritional alternatives that you can offer this patient.
Yes, ma'am. There are two main possible options are that enteral nutrition and parenteral nutrition. In
Yes.
enteral nutrition, we have nasogastric, nasojejunal, and percutaneous endoscopic gastrostomy and feeding jejunostomy. While in parenteral nutrition, we have total parenteral nutrition and partial parenteral nutrition.
Yes, but how would you go about and offer rich nutrition to this patient who already has an ostomotic leak?
I would like to do total parenteral nutrition.
Yes, NPO and total parenteral nutrition.
NPO and total parenteral nutrition.
What are the benefits of offering total parenteral nutrition to the patient?
And it's got that there is a gut atrophy and dissection of the gut, so there's a defunctioning of the gut. So during that, we need some nutritional buildup for this patient. So that's why we prefer parenteral nutrition, and it contains all the necessary elements such as water, carbohydrates, lipids, and all the essential elements that will provide the nutritional requirements for this patient.
Other than glucose, what is the highest energy containing source in total parenteral nutrition?
It is lipid, which is around 30 to 40%.
Good. What are the other constituents of total parenteral nutrition?
Other are water,
Yes.
proteins,
Yes.
electrolytes, essential elements, and vitamins.
Yes.
And nitrogen. Sorry.
Yes, nitrogen as well. Good. What are the vitamins that are included in total parenteral nutrition?
This is a combination of fat soluble and not fat soluble vitamins.
Both.
The fat soluble vitamins are vitamin A, D, E, K, and the other one is the vitamin B12, B complexes.
What are the methods by which one can offer or give parenteral feeding to the patient?
There are two methods: central placed catheter or peripherally inserted central placed catheter.
All right. How would you go about and do the monitoring if you've given parenteral nutrition to the patient?
There are different time durations for different monitoring of the different parameters. For example, if the weight should be monitored daily. Otherwise, if there is no concern, we reduce to monthly. And if we cannot measure the weight, we can measure the mid-arm circumference and the tricep skin fold thickness. BMI should be measured at the start of the feeding and at the end of the meal. And there is a daily electrolyte monitoring, and which can be reduced to twice or thrice a week if it is normal. After that, we would like to do
electrolytes.
weekly.
What other ingredients or substances you have to or one has to measure on daily basis?
Other than electrolytes,
urea creatinine.
I will come to the question.
Yes, urea creatinine. And maybe glucose as well. Okay. And what about which constituents one must follow or one must monitor twice weekly?
Twice weekly.
Liver function
Electrolytes,
test. No,
sodium, potassium, and
albumin and liver function test. Okay, please tell me, right, one indication you've already told that this patient is in needed. What are the other requirements or indications for writing
yes,
or for advising total parenteral nutrition?
Yes, ma'am. In this case, there is a non-functional bowel. Other cases are inflammatory causes such as inflammatory bowel disease and multiple fistulas, short gut syndrome, and there is there is a lack of access to the bowel, like head and neck surgeries, and other conditions are severe malnutrition, sepsis, multiple organ failure, severe trauma, severe burn. So these are the
Right.
all other conditions in which
What do you
have to be part.
understand by the term enteral nutrition?
The food which is giving through the oral route and use the gut for their reabsorption.
Okay. Orally, right?
And
How
and
would one assess the nutritional status of a patient? Just suppose this one, how would you assess? What are the parameters that you'll keep in your mind in order to assess the nutritional status of the patient?
serum albumin level, nitrogen
First,
balance.
history, then
Uh,
examination, then
After complete history and examination, there are few parameters such as serum albumin level, nitrogen balance.
these are the
And
signs of malnutrition that you're telling me. Assessment is on the basis of
daily body weight,
comorbidity. Yes, okay, you could say that. Yes. Then
body weight,
comorbidities.
mid-arm circumference, and
All
skin
right.
fold thickness, comorbidities, if
Yes.
he's having some kind of chronic illnesses.
Yes. Yes.
And there are some lab
And
parameters such as
and
albumin.
recent surgery. That
Yes,
is also one parameter that one has to keep in their mind. Okay. Now tell me the signs of malnutrition that that one should consider.
hypoalbuminemia,
Yes.
uh, increased nitrogen balance,
Yes.
mid-arm
Hyperkalemia.
circumference and skin
Okay.
hyperkalemia, mid-arm circumference and skin fold thickness.
Yes.
And
What is the daily nitrogen requirement for a healthy person?
it's around 0.15 to 0.2 kg, 2 gram per
2 gram per
kg.
kg. Okay. Right. You can tell me the total, right. What is the dextrose that is present in the total parenteral nutrition? How much is it?
And the maximum amount should not be greater than 5 gram per kg
Okay.
in the 24-hour feed.
Right. What are the complications that can result because of giving total parenteral nutrition to a patient?
There are two kinds of complications related to the line related and the feed related. The
Yes.
line related are infection, sepsis, thrombophlebitis, air embolism, and pneumothorax. While the feed related complications are fluid overload, hypoglycemia, hyperglycemia, and electrolyte imbalancement such as hyperchloremic metabolic acidosis, hyperlipidemias, refeeding syndrome, and gut atrophy,
Yes.
and deficiency of the essential vitamins as well.
Okay. Right. So because of gut atrophy, that can result into what?
Uh, because of the gut atrophy, there is a loss of integrity of the mucosal epithelial cells, and
Yes.
this will lead to the increased bacterial translocation.
Yes. Very good. Right. So how would you calculate for it? Okay. How would you calculate for a post-surgical patient like this one? Not necessarily has sepsis, but this one, how would you calculate the TPN for a 70 kg patient? How much should it be?
Madam,
The
this calculation is
calories, the
basically depends.
kilocalories.
Yes, this calculation is basically depends on the calories level that a person should require. The normal person required
No,
around
not
20 to
normal. I
20.
said post-operative, but not having sepsis. This one, 30 years
Uh,
old, 70
uh,
kg.
so initially he requires a less amount because of the risk of the refeeding syndrome, and the amount for this person is around 10 to 15 kilocalorie per kg per day.
Okay, please tell
And
me
there
what.
is one equation that actually used for calculation of this calories requirements.
Please define what do you understand by the term refeeding syndrome?
It is a metabolic disturbance which occur in feeding a person after a prolonged duration of starvation, and it is characterized by hypophosphatemia, hypomagnesemia, hypokalemia, and increased fluid overload.
Okay, good. Thank you. And this is the X-ray of the patient. What
Yes,
is
ma'am.
this red arrow is pointing at the sign?
This is dilatation of the small bowel loop, and this is a volvuli conjunctivis. And along with that, there is a thickening of the fold, which may be thumbprinting sign.
Yes, thumbprinting sign. And what does it signify?
It signifies there is some obstruction in the bowel, which in this Crohn disease, there is a strict possibility of the stricture. The stricture
Yes.
can cause the dilatation of the
Good. Thank you.
bowel.